Hi there, I'm Tiffany, the patient care coordinator here at the Aesthetics Center, and I have Olivia Ray with us, one of our rhino patients. So we had about 45 different people write in questions asking about her rhinoplasty process, and several of them were repetitive, so we narrowed it down to about 11 really great questions that I'm going to interview Olivia about and give you the answers that you've been wanting to know. Are you ready?
Yeah.
All right. Okay, so from Erin, what was the hardest part of post-operative healing?
There wasn't really a necessarily hard point, but it was more just kind of an annoyance. I had a runny nose for about a week, and that was probably the most annoying part of it.
Okay. I remember you saying it wasn't like it was crazy painful. It was more like sleeping propped up or with pillows on the side of you. That was just annoying. Yeah. And I think you probably got tired of just the cast and looking kind of beat up every day.
Yeah, definitely.
Even though we prepare you for that, it still seems to be sort of an issue with our patients that, you know, as much as we tell you that you're going to look rough, it still kind of hits hard on like day 5 when you're looking in the mirror and you're bruised and you have a cast on your face. But that's probably the bigger issue than it is a pain issue.
Yeah, definitely.
Shelly would like to know, ironically, how painful was your recovery?
Slim to none. I only took my pain meds for about a day and a half. And after that, I really was fine. And like I said, it was more of an annoyance than a painful recovery.
So how often did you take your pain meds?
I tried to stay on top of it. They recommend the first couple days that's kind of your main focus, so you never get to the point of it hurting. So I took it, I want to say 4.5 to 5 hours.
Okay, very cool, good to know. Heidi would like to know, how long did the bruising last and when were you able to cover it with makeup?
For me, the bruising lasted around a week. Luckily, when I came in to get my cast off after 7 days, I was able to get zapped by laser under my eyes to help with the bruising, and after that it was gone after about 24 hours, and after that I was able to cover the small little bruises with makeup.
I do remember you saying, and this is important for you guys to know if this is something you're considering, that it's kind of anticlimactic when you get that cast off, because you're wishing, even though we prepare you and tell you ahead of time, but you're hoping and wishing that all of a sudden your new nose is there and you're going to feel so great and beautiful that day. And honestly, you really do look pretty rough and probably worse than you did before you came in. She actually had a crooked nose, a pretty significantly crooked nose. And so I think even she was a little bit looking forward to having that straight nose and looking in the mirror and liking it better. But honestly, the swelling creates like no bridge here and the bulb gets really big. And so it's a little bit of a letdown. So you have to emotionally prepare for that it's going to take months and months for that swelling to go down. And even today, I think you still have some swelling in your bulb that probably around month 4 to 6, we're going to see a significant change in.
Yeah, definitely.
Maribel would like to know, how was the healing process and are you happy with the results?
The healing process was, like I said, really easy, not painful. And it was just those small things like having to sleep propped up for a couple weeks or just having a runny nose. But so far I am so happy with my results, and I can't wait as time goes on to see it get even better.
Awesome, that's good to hear. Alana said, what were your aftercare procedures? How soon after surgery were you presentable enough to go out in public, and are you able to breathe well, and does your nose drain at all? So that's a long question.
Some of the big aftercare procedures that they like you to try and focus on is staying on top of your meds, cleaning your nose every morning and night, or at least a couple times a day, so your stitches are clean and there's no risk of infection or post-op complications, and saline spray every single hour, and you can even do more than that, and it just helps with the buildup that you get. And like I said, I had a draining nose for about a week, and I still have times that I struggle with it a little bit, but not bad at all.
And how far out are you right now?
I am about 3.5 weeks.
Pretty impressive. So how soon were you presentable to kind of go out with friends in public?
I started putting makeup on, I think, after I got my cast off, just to cover the last little bruises under my eyes. But I felt pretty normal after I got my cast off.
And do you feel like you can breathe better now?
It's still a little swollen on the inside, but even with the swelling, it's a miraculous difference from before.
Awesome. All right, Kate asked, were you scared about anesthesia and what was it like? What was anesthesia like?
I personally wasn't scared, but I could definitely see how some people could be. And getting the anesthesia was, I don't even remember it, barely. I don't remember them putting the IV in me because they give you a little numbing shot. And then next thing you know, you're all sleepy and you're out.
Awesome. I remember the morning of your procedure, she had taken a Valium, which is something that we offer to our patients to help take the edge off before surgery. And you said to me, I'm actually trying to stress myself out and I can't.
Yes.
You felt really calm.
I'm the personality type that stresses about everything under the sun. So that morning of, I was getting some nerves just like anyone would. And as soon as I took that Valium, it was all gone.
Awesome to know. All right, Carrie said, how has your self-confidence improved and has your breathing function improved?
My self-confidence has completely changed. I was always really insecure about my nose. It's always been something I've kind of tried to hide or kind of tried to fix with makeup. So to have that straight nose and be able to go out and not have to think about it or worry about it in the back of my head has been life-changing for me, and my breathing has improved miraculously.
Awesome. So Christian said, were you in pain afterward? And if so, how much? Do you feel like you look too much different than yourself?
Like I previously said, it really wasn't that painful of a procedure or post-op, as long as you stay on top of your pain meds for those first couple days. And I personally don't think I look that different. Dr. Rice does such an amazing job of giving you what you want, but also not making you look scary at all.
Yeah, I think it's interesting when we talk about looking different from yourself, just sort of trying to fine tune what you already have.
Yeah.
And correct any mistakes. And as far as pain goes, I think it's important for our viewers to know that she actually had her septum corrected as well as a turbinate reduction. So she had some of what the world would consider a little bit more painful of a procedure. So it's kind of good for us to all hear that you didn't feel like you were suffering or struggling through that process at all.
Yeah.
Good. All right. And Stacy says, are there any long-term complications with breathing or pain?
So far, nothing yet. But Dr. Rice has assured me that I should have totally normal breathing function.
Awesome. Allie said, did you get to choose the shape?
Yes, that is one amazing thing that the Aesthetic Center and Dr. Rice does, is when you come in for your consult, they have this imaging on their computers where you can say, I kind of want this about my nose, or explain to him what you want, and he's able to change the shape of it and show you what you would look like.
I think you said you cried after.
Oh yes, I got in my car and cried after my consult.
You were so excited.
Yeah, like I said,
good tears.
Yes, it's always been such an insecurity of mine. So finally seeing it the way I've always imagined it, was a big difference.
Awesome. Mihaela said, any regrets and any side effects?
No regrets at all. I would do this 100 times over, and I would recommend it to anybody. And no side effects so far.
One of the interesting things here as the patient care coordinator is that I get the opportunity to meet with every one of our rhinoplasty patients before they decide whether or not they want to do their procedure. And it's interesting to me that I will have every kind of age range that comes in here all the way up until a couple weeks ago. I even had a 63-year-old. And they all say something very similar, which is, I have hated my nose or been insecure about my nose since about middle school or high school, and that doesn't change. So I think it's interesting when someone writes in any regrets. From a patient care coordinator's side, I've only seen people that have lived with something that they didn't love about themselves for many, many years and are super excited and happy at the opportunity to finally love their nose.
Yeah.
So I think that's all the questions we have today.
Yeah.
So thanks for listening.
Thank you.